folks before we open it up for questions. Again, thank you for coming.
Thanks.
Give him a megaphone.
Is it on? We don't hear anything.
You don't hear anything? Hear anything now?
Oh, yeah.
Whoa!
Is it over launch?
If you have any recorders or anything you want to put up here, I'm fine with that
Sounds
too.
bad?
I want to help you in any way we can.
That's not useful.
Are you okay? Testing, 1, 2, 3, testing, 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 1, 2, 3, testing, testing.
Do you want to put the mic
Can I
on?
just put it here?
You want to do that? Well, everybody else can.
Testing, 1, 2, 3. Yep, no problem. Testing, 1, 2, 3, testing, testing. Trying to be helpful. I just put my wallet. Okay,
One
level
more.
good?
No, one more. One more.
One more? Two more. Let's put it down here so it doesn't mess up the picture. That's okay, good. Are we advertising for your station?
I just want to make sure I hear you.
I want to make sure you hear me too. Okay, we ready? Everybody? Good. Well, good afternoon and thanks for coming. I'm Bob McDonald, the Secretary of Veterans Affairs, and I wanted to let you know that we're here today to talk about putting veterans first. Taking care of the veterans is the highest calling that we could have, and we've been spending our time here in Florida exactly working on that. We're making changes, and we're trying to turn the page from the crisis that we've been in to improving our care for veterans, forging the partnerships that we need in order to serve veterans. I'm pleased to be joined by Tim Leitzer, the director of the VA Medical Center. Also with me today is the chairman of the House Veterans Affairs Committee, Mr. Jeff Miller, Chairman Jeff Miller. Jeff has welcomed me down here to Florida, and it's been nice to spend time with him both in the Tampa area as well as here in Orlando. I'm also pleased to have Congresswoman Corrine Brown with us, also a member of the House Veterans Affairs Committee, and we are in her district. So it's nice that she has invited us down and welcomed us to her district. I have thanked both Chairman Miller and Congresswoman Brown for all of their work on behalf of veterans. Both were big advocates for the recent bill that was passed. Both care about veterans, and it's been wonderful to have them here. I think that the swiftness of my confirmation, the unanimity in the confirmation vote, and the work that's been done to pass the Veterans Choice Act demonstrates the unanimity of Congress and the unanimity of the government, as well as the unanimity of the American people and the need to care for our veterans. Today I met with, of course, Chairman Miller and Congresswoman Brown, but we also met with Representatives Micah, Grayson, Webster, and DeSantis. And as I told that group of congressional leaders, as I've gone around the country and met with various stakeholders in each geography, the representation that Florida has had, showing their concern for veterans, is simply outstanding. It's one of the best I've seen. And I was very proud to be in the room with them, and we were working these veterans issues together. I also had the opportunity to speak with representatives from veteran service organizations to get their feedback, and we appreciate their support as well. Included in that group, of course, were representatives of the Florida Department of Veterans Affairs, and we, of course, work closely with them. Chairman Miller and Congresswoman Brown and I have seen many of the services that VA provides here in Florida. On Tuesday, Chairman Miller and I had the opportunity to visit, first we visited some facilities in Tampa. Before that, I visited the Sarasota National Cemetery. I don't know if you've been there, but you've got to go. It embodies what I know to be true of VA cemeteries across the country, which is they are national shrines, and we want them to be that way. The National Cemetery Administration tops other federal agencies and private companies in their rating of #1 customer satisfaction, which is done by an independent organization called American Customer Satisfaction Index. I also had the opportunity to see the Patriot Plaza for the first time. The Patriot Plaza was funded by the Patterson Foundation. It's an outstanding amphitheater facility, seats nearly 3,000 people. Has a great stage and orchestra, great sound baffling. But importantly, around it are many reminders of military service and sacrifice that's made. Photos, which will not fade in the sun, sculptures of American eagles and others. It's just a fantastic facility. I'd like to encourage all of you to go out there on November 15th when it will be dedicated. There'll be a big event there. We're going to be sending someone from Veterans Affairs, and I hope that it gets good coverage because it's a fantastic facility, November 15th. Yesterday I spent the morning at the St. Petersburg Regional Benefits Office. I had the opportunity to speak with Carrie, who runs it, and her employees. I told the employees I'm proud of them for the work that they've done and that they're doing to transform our Veterans Benefits Administration, because the work that they've done to get down the claims backlog is nothing short of remarkable. We still have more work to do. Thanks also to the transformation efforts, Florida veterans are waiting 88 fewer days for a decision on their claim. Back in February of 2013, that was the peak of the backlog. We've driven it down 88 days, and it's now 162 days. I still think 162 days is too long, and when we were with Carrie and her leadership team, we talked about the steps we could take to drive it down further and faster. They'll complete more rating decisions this year than they ever have before. More than 5,550 more Florida veterans will be served this fiscal year than last year, and the year is not over, so we're going to obviously exceed that number. We set a bold goal for VBA to end the disability claims backlog, and we're on our way to do that. It's not going to be easy. We've got more work to do to get there. Nationally, we've reduced the backlog of disability claims by 57% since its peak in March of 2013, while at the same time we've increased the accuracy of those decisions and the quality of those decisions. But obviously, there's still work to do. Today, we had the opportunity, both Congresswoman Brown and Chairman Miller and I, to speak to residents from UCF Medical School. We did what's called in the medical profession grand rounds. We had a room full of residents that work at VA and go to the UCF for medical school, which is, of course, very close by. Less than a month ago, I launched a national campaign to hire more doctors, more clinicians, more nurses for the VA. We obviously have a demand that's greater than our capability, and we need to go out to medical schools to hire these people in order to serve our veterans. Today I told the residents that there's no higher calling than working for the VA and no better patient than our veterans. And they reinforce that because these residents see our veterans every single day. This is one of the reasons I came to work at VA. Being a veteran myself, I wanted to use the skills that I've learned over the last 40 years to help our veterans. Across the nation, we've taken actions to get veterans off of wait lists, to get them into clinics in the short term, but in the long term to help provide timely access to the medical care that they've earned. These academic partnerships, like the one we have at UCF, are actually absolutely critical to what we do. Whenever I talk to residents or medical students, I remind them that the VA has had 3 Nobel laureates as part of our group of scientists and doctors. We've had 7 Lasker Award winners, which is a very coveted prize on the cutting edge of medicine. And we're doing work in research in the cutting edge of medicine, things like spinal cord injuries, things like mental health. These are things that we see in the VA that we can innovate that help the American public in general. So the research we do in VA is critically important. The education role we play in VA is incredibly important. 70% of U.S. doctors have worked in the VA at one time or another during their careers. And our doctors also are the professors at the medical schools, the best medical schools in this country. If you go to Stanford Medical School, Harvard Medical School, Duke Medical School, here at UCF, these doctors also are doctors at the VA. So that educational component is important. The research component is important. And of course, caring for our veterans in our clinics is important. Everywhere I go, I talk to employees. I have town hall meetings of employees. I listen to their concerns. I try to get them involved in our change efforts. And we had a town hall meeting this morning, and I want to hear from them. As I've said in the past, in my opinion, I want whistleblowers. I want people criticizing the way we do things, and I want them involved in creating the change. Everywhere I go, I also talk to veterans. We've talked to a lot of veterans today. My question to them is, how are we caring for you? Are we taking good care of you? We get their feedback, and we make changes. Actually, the veterans typically tell me that they receive good care in the VA. The challenge in some locations is to get them into the care to begin with. And I've heard many of our veterans call people that care for them, particularly the nurses, angels. And if you're here in our hospice facility, you would meet some of the angels that we have, and it's here in this building. So the problems we've had in the VA are all well documented. And we're working hard to repair those problems and at the same time repair the trust that we may have lost with our veterans, with the American people, and with other stakeholders. We know that we've got to earn back that trust, and we know we have to earn that one veteran at a time. At VA, we've got a very clear mission. It's a high calling to care for veterans. We've got very clear values. They are embodied in this acronym of I care. I stands for integrity and so forth. And C is commitment, A is advocacy, R is respect, and E is excellence. Those values are very important. When individuals behave inconsistent with those values, we seek a disciplinary action against them aggressively and expeditiously. But we want everybody in our organization to behave consistent with these values. That's one of the reasons that one of the first things I did as Secretary was to ask our leadership to go through the organization, work through every employee, and make sure every employee recommitted themselves to our mission and to our values. That's obviously the foundational element of our organization. So I'm convinced that the framework is in place. to regain that trust, but we got to keep working at it, and we will. We're going to turn the page. We're going to right the wrongs. We're going to discipline the people who deserve to be disciplined. We're going to look at everything we do through the lens of the veteran, and we're going to improve our services to all veterans. Part of regaining the trust is by getting veterans off wait lists and into clinics. As you know, we've developed the Accelerating Care Initiative to increase timely access to care for veteran patients, decreasing numbers on the electronic wait list longer than the 30 days. We're reaching out to veterans who have been waiting for care, more than 302,000 nationwide. In fact, here in Orlando, we've reached out to more than 1,380 veterans to get them off wait lists and get them into our clinics. We've increased community and non-VA care. Orlando has received almost $4.3 million in order to provide care in the community. If we can't get it done, if we don't have the technology or there's a distance issue, we will help people get care in the private sector. We've expanded clinic hours in the Orlando VA Medical Center, and we provide weekend appointments so that veterans may be seen more quickly. We're also addressing the need for additional space. In fact, we spent quite a bit of time on that this morning. And we're also, of course, have under construction this new medical center, which is going to be spectacular. Chairman Miller and I and Congresswoman Brown had the opportunity to tour this facility and talk to the engineers and the people who are preparing it for opening. We expect construction to be completed by early next year, and we're all excited about coming back to see that. Once completed and turned over to the medical center, we estimate we'll be able to see patients in 90 to 120 days. Tim and his people are already preparing for that time. In the meantime, Tim and his team have made changes to better utilize the space that we already have. We've relocated the community living center. We are in it now, in the domiciliary to Lake Nona, and are now repurposing the space at Lake Baldwin to expand our services there. This has allowed our primary care team and several specialties to be served in Lake Baldwin. There's additional space for services in audiology, eye care, rheumatology, pulmonary, nephrology, and endocrinology, and that's better for patients. In addition to accelerating access, we are also making system-wide changes to improve the long term. The 14-day access metric has been removed from everybody's performance appraisals. We're simultaneously updating our antiquated appointment system, first making changes on the current system, a number of changes sequentially, but then at the same time, we're working with outside companies, private companies, to bring in an off-the-shelf scheduling system and implementing that as quickly as possible. We've asked our regional directors, medical center directors, and network directors to do face-to-face audits in all facilities so we know what's going on the ground. I've also asked for town hall meetings on a continuous basis, and I'm trying to be a role model for doing those town hall meetings as I go around to each facility. We're building a more robust system for measuring consumer satisfaction or veteran satisfaction. We haven't had that in the past, and we're putting one in place. And at VA, we're setting the course for long-term reform. This is all part of our 90-day plan, what we call the Road to Veterans Day plan. Part of those long-term things we're working on include restructuring and reorganizing the VA. We have 9 different geographic maps of structure. We have no integration below the level of Secretary. And if you're a veteran, we have multiple websites that require multiple usernames and multiple passwords. If you're a veteran and you look at this organization, you would be as confused as I have been. It's a very complex organization. It was amalgamated over a period of time. We need to step back and figure out how to simplify the organization, flatten the hierarchy, integrate the organization so the veteran knows who to call, who to see, who to talk to get all benefits done, not just one from a particular silo. We are all about veterans. It's the only reason we're here. If it weren't for the veterans, we wouldn't be here. I am a veteran. I care about this, and we're going to make sure that we apply the best principles of the private sector and of business to get more focused on our customer, the veteran. We're going to judge our success by only one metric alone, and that is veteran satisfaction. And they will tell us every single day. They're not bashful. We're going to work with partners. We're going to work with members of government, particularly the House Veterans Affairs Committee, the Senate Veterans Affairs Committee. We're going to work with veteran service organizations. We are going to work with all partners, non-government organizations, to get this job done. We know we can't do it alone. But we're busy turning the page, improving our rebuilding of trust, improving our care for veterans, and importantly, working on the long term as well, since we know there's a lot of work to do to really improve going forward in the long term. I'd like to invite Chairman Miller and Congresswoman Brown to say a few words if they would like, before we take questions. Thank you.
I really don't have any additional comments. I think he's covered everything. I'm looking forward to the question and answer. But isn't this a beautiful facility? And I'm so happy that we was able to open it up early. I think we have, 120 patients here? I came for the opening, and this is a beautiful facility for our veterans. And I love the theme, putting veterans first.
Absolutely. Thank you.
I want to thank the Secretary for accepting our invitation to come down and visit not only this facility, but to see several others in the Sunshine State. Ms. Brown and I serve on the Veterans Affairs Committee together. I am the chairman of the committee. I'm the 1st District of Florida, which is the Western Panhandle. And I just want to say how grateful I am to the Secretary for being willing to come out of the ivory tower of the central office in Washington, D.C. And get in the trenches with the people who are actually dealing with veteran issues and problems every single day. I will say that the Secretary, the department, will have issues that we'll all have to contend with in the future. We understand that. But he's a gentleman that wants to see action quickly. I've already seen that today on several issues that I brought to his attention. And I have to say, it is a breath of fresh air to have somebody who is as responsive as they are come to our area and certainly all across this country. So, Mr. Secretary, I say thank you for your service to our nation and your ability and desire to come back and serve it again as the Secretary of the Department.
Thank you, Chairman. Any questions or comments? Yes, sir. I'm sorry.
My name is Bill Apgar. I'm an independent journalist and a 100% permanent total disabled veteran.
Thank you for your service, Bill.
Thank you.
What branch of service?
I was in the Navy. Served a year and 3 months. Got out on an honorable discharge, but due to military sexual trauma. But I was given a personality disorder. My question is, all those veterans that missed out on VA benefits for years that were given a personality disorder now are given PTSD. Are you, as the new secretary, going to help them get fully compensated for being wrongly misdiagnosed?
You may have read the Department of Defense announcement that those files would be looked at again. I'm meeting Monday with Secretary Hagel, and we're going to start going through that and working with the Department of Defense. We have a very good relationship, and we're going to be working hard to do that.
Representative Miller and everybody has, it's a bill that's been sitting there in the subcommittee for well over a year, and that's H.R. 975, the Mental Health Review Act. I was wondering if you're aware of that and if you could touch on that. Yeah, either one of you.
We're approaching the end of the 113th Congress at this time. We will have a couple of more hearings. It's not scheduled for a hearing this Congress. However, I'm aware of the issue as well, and I see activity happening from within DOD and within the Department of Veterans Affairs to correct what to many was a wrong, and it will take some time in order to do it.
Thank you.
I do want to make one breaking news announcement. The Secretary lives in Orlando, Florida. He has a house here. I know y'all might want to know that.
Good.
Well, we were talking today of the problem that we have in parts of the country where veterans want to settle. They want to settle in the South, the Southwest, and I'm living proof of that. My wife and I have lived over 30 years in Cincinnati, Ohio. 16 of those 34 years we were abroad, living abroad, and I was planning to retire from the Procter & Gamble company. We looked all across the country as to where we wanted to locate, and we bought a house in Orlando. We have 2 grandchildren, so you know why we did. But we're thrilled to be here, and I am living proof. I'm not going to be able to use the house as much as I'd like since I'm working again, but I'm living proof of how we need to stay ahead of the demographic trend that's obviously taxing our capability here in Florida. Yes, ma'am?
What have you been told as far as the Legionnaire's disease goes in the water here? What are your concerns regarding that?
Actually, we went through that in great detail with the members of Congress earlier today. It's a very complicated subject. Let me try to take you through it, and then I'd like Tim to comment. This is something we are very concerned about, learning from the VA experience in Pittsburgh, where we had this occur. Legionella, or Legionnaire's disease, or whatever you want to call it, tends to travel by air, not by water. And what we've done in VA, in our hospital system, is we've set a zero tolerance level, 0. Most water systems and other regulatory systems in the country do not have a zero tolerance level. As a result, our requirements are much more stringent than would normally be the case. And this is a bacteria, this is an organism that is alive around us. So we do testing, regular testing, which we've done here. And let me ask Tim to take you through that because it's very technical. Tim?
We've been tracking this since about June. And the way we track it is through the urine antigen test, meaning it's a clinical test. And the antigen test...
Could you stand behind me? Sorry.
The antigen test just tells us that the person was in contact with a Legionella bacteria within the last 12 months. When we got the positive test, we went on a bug hunt. Legionella is a bacteria. It's widely available in the environment. The clinical risk is when it translates from water to air and is breathed in, and that is what forms Legionella pneumonia. We had 3 veterans test positive on the antigen test. That does not mean they have Legionella or active Legionella. And in all 3 cases, that did not transfer to Legionella pneumonia. When we became aware of the positive test, we started actions immediately to mitigate and determine where the bug was. And the best that we can ascertain is it came through the water. We had a disinfectant system that may not have been complementary to the way the city disinfects for that bug. We super chlorinated the system to eradicate it back in August. We did continual testing, and we've been tracking the level of chlorine, which is a primary disinfectant for that. And we've been making sure that that level was appropriate standard. We had and then, by the way, we started testing all outlets, meaning we go in, we take a water test, and it takes 14 days to complete that test. So we've been monitoring that, and every time that we have a positive hit, by our own internal policy, we go back and we mitigate that. We superchlorinate, or we deal with that in other ways.
So a positive hit is anything above 0. That would not be the standard in communities across our nation. So I just want to be clear that we're talking about a different standard. It doesn't mean you're drinking unsafe water, but we have a different standard because of what we've learned from Pittsburgh.
Have you reached 0 yet?
We have not reached 0 yet, and the system that we're going to install actually this weekend is a complementary system using chlorine dioxide to complement the regular chlorine injection system that the domestic city uses. So next week, we hope this will be behind us, but we'll continue monitoring and ensuring. The good news is, since we went on this bug hunt starting in July, there has been no positive antigen tests since then. So while we have small counts of bacteria being tested in the water intermittently, that appears to be behind us.
Are you saying these people didn't get sick?
They did not get sick due to Legionella. They had underlying issues that may have caused them to be sick or hospitalized.
Tim, what is the typical community standard around the country for the bacteria?
Our research has indicated there's no real published standard other than what OSHA publishes, and that standard is 10 colony-forming units per 100 milliliters of water. We have been working very closely with the Department of Health through this whole issue. They've been very helpful in guiding us on action plans and mitigation plans and recovery.
Secretary, you and I both met with some pretty frustrated veterans today. What did you say to them, and how well do you feel like your message was received?
Actually, I didn't find the group I met with today any more frustrated than other groups I've met with. In fact, I found them to be very helpful, and I think the partnerships we have with those veteran groups that you heard from today are essential. We've got veteran service organizations helping us develop fully developed claims, which is going to allow us to drive the claims backlog down further. We've got veterans who work as greeters and guides in our medical facilities. So I get inspired by meeting with veterans because they're all want to help, and that's the wonderful thing about my job is I've not met anybody who doesn't want to help veterans.
Secretary, we met with one veteran today, a U.S. Army veteran who lost his eye to glaucoma. He says primarily because he was not received as far as his benefits. It took so long to deal with that and process them. You talked on a number of issues as it relates to improving veterans' affairs. What specifically, as you took tours here as well as Lake Baldwin, did you see that you would like to see change even more as it relates to Orlando specifically?
Well, I think the thing we've got to do in Orlando and across the country is build the capability for the huge surge in veterans that we have. Over the last few years, we've had a number of things that have created this surge in veterans. First, inverted veterans' needs. First of all, the veterans today, on average, have about 6 medical complaints, versus after World War II, they had 1. We've qualified Agent Orange as a way that people qualify for benefits. We now know a lot more about post-traumatic stress and mental health issues that weren't available or weren't knowledgeable then. My father-in-law was the tail gunner on a B-24. He was shot down over Germany. He was a prisoner of war. He had post-traumatic stress, but I didn't know that until recently. And he was a different man once he got connected with the VA and once he got in a prisoner of war support group. So the science continues to advance, and we've got to find ways to be able to care for the huge influx of veterans that we have. We got to build more facilities and lease more facilities. We're in the process of doing that. And we've got to hire the doctors and nurses and the clinicians to go into them. When Chairman Miller and I were together in St. Petersburg, we heard from the University of South Florida College of Medicine that Florida needs 22,000, will need 22,000 more doctors in the near future. These are staggering numbers, and we've got to find ways to work with the medical school association to create the doctors we need. We have huge issues in rural areas, and we have huge issues in some specialties.
With PTSD, why are some veterans labeled as mental? Like, for instance, the military sexual trauma disabled veteran, he's now labeled as mental. You know, the sexual traumatized victims of Penn State, the sexually traumatized victims of the Catholic Church, what do they have? They have national media attention, a big fat paycheck, and they're not called mental, but disabled veterans are.
What we've learned about mental health, we're on the cutting edge of mental health. The research that we do is cutting edge. I was in San Francisco at the medical school this last week, talked to Dr. Stephen Hauser, doing some fundamental research to show the similarities between mental health that comes from military blasts, collisions, the things firefighters and police go through, the things that NHL participants go through, NFL participants. We're making huge advances here, and then that's very important. Separately, we as a society have to get rid of the stigma that mental health is somehow something that is a figment of imagination. It's not. It's real. And what we've learned is that when we get people into mental health clinics, we don't want to have a sign out front that says mental health in neon lights, but rather we want to bring them in through primary care. So we're learning a lot about it, but we need more mental health professionals, and that's why I'm going to medical schools to try to recruit and hire more mental health professionals. Can I go to someone else, please?
Yes, please.
Because you've been talking.
You talked a couple times about the need to make sure Orlando has the capacity for
Yes.
the need. You were, I think, called this morning,
Yes.
Congressman Brown and other congressmen, people from this district, want to see that facility not only continued, but perhaps seeing some of the services return there. From the
Yes.
He gave us an update on that.
I'd like to hear from you if I could.
Let me let Tim talk about it, but we're going to repurpose that facility, and we've got some pretty exciting plans.
It is going to stay open.
Before we go there, let me just mention the history of that facility, because that facility was on the chopping blocks with BRAC, and we was able to get the Department of Defense to give it to the Department of Veterans Affairs. That was a win-win for the veterans without any cost, and we got the money to convert it. And so now we're talking about, and at that time we had no separate facilities for women veterans. So we have come a long way as far as veteran facilities in the Central Florida area. And I do want to mention before I give the mic away, 40% of the people that work in the VA in Central Florida are veterans. All right.
We were very pleased to hear the announcement that Lake Baldwin would stay open after the move to Lake Nona. It's a defined need that we've been observing for a number of years now, and with congressional support and the support of Acting Secretary Gibson at that time, it was approved. We are working on the plans to repurpose it. Right now, we believe it's an important primary care access point for those veterans living in North Orange County and South Seminole County. Along with that, we think there's abilities to collaborate with our sister agency in the VBA and possibly look at moving the service center presently located downtown next to the place that we will be doing comp and pen exams. We also have a great need for mental health services. And then we're looking beyond that to take a look at how we can collaborate with perhaps the state or other agencies to provide other services in the nursing home or in the domiciliary there through assisted living programs. With regard to specialty programs, we are looking at those type of programs that make sense. In many of our specialties, there's a need to have other ancillary support services there, laboratory, sterilization if you're doing procedures and whatnot, and also plan to stay there as a pharmacy.
Last question, right?
Secretary, John Micah said the Lake Nona facility is a poster child for how not to do things, and that we need to improve these hospital facilities by getting them online or let the private sector provide these services. How do you think the private sector could help, and is that something you're looking into?
Well, I was with Congressman Micah earlier today, and I didn't have that discussion with him. He didn't mention that to me, so I don't know the context of his comment. But certainly in my private sector experience, I've built a lot of facilities, and I built them all over the world. So I have to talk to him to understand the context of his comment. Certainly there's a lot to learn from the private sector, and what we're trying to do in improving the Department of Veterans Affairs is to use what we've learned from the private sector to become a truly consumer-centric or customer-centric or veteran-centric organization. I often use the example that most organizations you think of as a pyramid, and on the base of the pyramid is the customer, and you have your sales force, which is usually your largest force, and at the top may be the CEO. And I take that pyramid for Veterans Affairs and I invert it, and I say across the top is the veteran. They're the ultimate. They are what we're here for. Next we have the people who serve that veteran, and I'm at the bottom. I'm at the apex, because what I'm trying to do is make the life easier so that they can accomplish the job of employees. And every town hall I do, I talk about that. I ask veterans to tell me, I ask employees to tell me what we can do better. We capture those ideas and we get employees together to work on them.
I want to add to that, though, because I probably have spent more time at this facility than any other member combined. And let's be clear, part of it is not just the VA, it's the stakeholders that we work together with. And bringing in all of those stakeholders, having the latest technology, things coming online, and we want the best in the facilities. So it's not just the VA, it's the VA working with the stakeholders to get the finished product. We want this facility open and complete, but we want it to be the best facility in the United States, and it will be when it opens up.
Thanks very much for coming. Thanks for your time.
Can we get pictures with you? Can we get a picture with you?
Secretary.
You want a picture with me?
That's right.
Sure.
Secretary, if you'd like the context, my question was, the building is 2 years old. It's not more than 30% of the budget. And, now that it is open, people get sick in the building. Isn't this an abject failure? That was my question. That's the context behind it.
I know. Chairman Miller, started an action at 10 and got together for the band. I know. I should have changed my hat. I just figured that I know I live in Florida now.
That's great. I like him. He's a nice guy. Those are pretty good. Who's Representative Miller? Oh, Representative Miller already left?
We'll take care of
One more minute before I leave. I'm going to make about that. Mr. Miller, taking care of your picture painting? Yeah. Sorry. We take picture.
Finally, did I get him?
3 or 4.
So it's about show me the money.
Y'all going back to driving?